Greetings. Welcome to Delirium with Dementia for the Caregiver. The purpose of this module is to discuss caregiving and the neuropsychiatric syndrome of delirium. So, the term persons living with dementia will be used to emphasize that dementia is a diagnosis and does not define the individual. Dementia is a highly stigmatized disease process. The purpose is to discuss the caregiving of individuals who may be diagnosed with dementia and also have delirium on top of it. Delirium is a neurocognitive disorder. Neurocognitive disorders such as delirium and dementia are cognitive, which means thinking. So they are conditions that occur in the brain and have an impact on how an individual thinks. Changes in cognition that have not been present since birth or early life are a change in the usual thinking for an individual. And this is what healthcare professionals need to understand as the individual's baseline. That's how we determine whether there are changes in the brain related to thinking. Older adults living with dementia are vulnerable or easily susceptible for developing delirium. The prevalence of delirium is 15 to 33% for older adults, especially when they are in the hospital and have surgery, and then after surgery, they can develop delirium quite commonly. Delirium is also present in 70 to 87% of older adults who are in intensive care units in the hospital. Up to 60% of persons living in nursing homes and 83% of persons at end of life will often experience delirium. So this is common. What is delirium? Delirium and dementia are both syndromes. A syndrome is a recognizable set of symptoms and physical findings which might indicate a specific condition for which a direct cause is not necessarily understood. Delirium and dementia are thinking disorders. So a neurocognitive disorder is a general term that describes a decrease in thinking and mental function related to some type of a disease that is not a psychiatric illness. So something is going on in the brain. Delirium occurs commonly in persons living with dementia, which is referred to as delirium superimposed or on top of or with dementia. Very often, caregivers are the first people to observe changes in their loved one living with dementia. When these changes occur, caregivers may contact their healthcare provider or family or friends and say, something is wrong. You don't know the why, but you recognize that something is different. It's what we call a gut feeling. Caregivers sometimes do not immediately recognize the cause of delirium. That's okay, as long as you recognize that there is a change. Caregivers are usually the first to recognize that something is wrong because caregivers know their loved ones best. So what are the symptoms of delirium? Symptoms are different from syndromes, which we just discussed. A sign is observed by an individual, like you, the caregiver, rather than being reported by the person living with dementia. One example of a sign of Alzheimer's dementia is short-term memory loss. A syndrome is a grouping of signs and symptoms. Based on how frequently these occur together, it may suggest a common underlying reason for why they are occurring. Healthcare professionals think of this as a pathogenesis, or how did the signs and symptoms develop? Where are they coming from within the body? Neuropsychiatric syndromes are clusters of symptoms. A system cluster is defined as consisting of two or more symptoms that are related to each other and that occur together. Neuropsychiatric syndromes are specific to the disorder. A symptom is a subjective manifestation of a condition that is going on in the body. Symptoms are generally reported by the person living with dementia, rather than being observed by the caregiver or healthcare provider. Symptoms of delirium are described as a change in mental status. Mental status includes the individual's appearance, their general behavior, their level of consciousness and attentiveness, their motor and speech activity, mood and affect, thought and perception, attitude and insight, and higher thinking abilities like balancing a checkbook or remembering how to bake a much beloved and used recipe. One of the most distinguishing characteristics of delirium includes the sudden onset of symptoms. Examples of symptoms of delirium are changes in the sleep and wake cycles of an individual, increased confusion, or emotional disturbances. Delirium can present in three different ways. Hyperactive means increased. And what we see is an increase in restlessness, agitation, aggression, wandering. They might have delusions or hallucinations. And those are more verbal and physical outcomes of how they're feeling. Hypoactive means decreased or low. So what we see here is a change in their motor activity. They're more lethargic, drowsiness, withdrawal, somnolence, which is inactivity, silence, or dreaminess. In people living with dementia, this is the most common type of delirium. We also have mixed. So we can have hypoactive delirium, which can follow hyperactive delirium and may be overlooked. Hyperactive and hypoactive, meaning high and low characteristics of the person, fluctuate or come and go in mixed delirium. Once again, here is just a slide telling you that both hyperactivity and hypoactivity can occur, one right after the other. One of the most distinguishing characteristics of delirium includes the sudden onset of symptoms. Delirium develops quickly, and symptoms fluctuate throughout the day. It usually lasts for a few days, but may persist for weeks or even months in vulnerable older adults. Delirium may be the only sign of medical illness or a rapidly deteriorating condition. For persons living with dementia, both delirium and dementia involve cognitive or thinking or memory changes. It is sometimes challenging to know if the symptoms are for something new going on in the body, like an infection of some type, urinary or respiratory, or whether it's the actual progression of the dementia disease process. Any sudden changes are significant. Confusion may be the only symptom of a urinary tract infection, pneumonia, heart failure, or any other condition which needs to be diagnosed and treated as soon as possible. These symptoms need to be reported to your healthcare provider for immediate follow-up. Delirium can be very serious It can lead to serious health conditions and even death. And it can be caused by many different things. What should you do next? Caregivers can pay attention to any of the characteristics of delirium. There are 5 diagnostic criteria for delirium. Attention and awareness, where attention is the reduced ability to focus or shift attention. So an example of a disturbance might be that they're not oriented to their usual environment. The second criteria is a change from baseline attention and awareness that develops over a short interval of time. This can occur over hours or days. The third criteria is the change in memory, orientation to where they are, their language. To make a diagnosis of delirium, the disturbance in attention, awareness, and cognition is not attributed to an already existing condition. Finally, delirium is due to many different etiologies. Complex assessment, treatment, and management by a healthcare provider is needed to prevent delirium. Early recognition of symptoms of delirium by caregivers can help healthcare providers to find the underlying cause. Treatment can eradicate the delirium. Generally, non-pharmacological interventions are the first interventions, such as managing the environment, but not using drugs. We can use, if they're not sleeping, then we can do tricks and teach you how to help them sleep, more importantly. So when there is a persistent delirium, persons living with dementia will experience further problems in their thinking. Dementia is a risk factor for delirium. Symptoms of delirium are present differently or referred to as atypical presentation in persons who are living with dementia, who may have already decreased ability for verbal expression. Symptoms of delirium are often overlooked. There are many overlapping symptoms of chronic illness and dementia that may overshadow the symptoms of delirium. Early detection, treatment, and management decreases mortality, morbidity, and improves quality of life for both persons living with dementia and caregivers. Caregivers who want to know more about neuropsychiatric syndromes of dementia are encouraged to participate in the entire Dementia and Neuropsychiatric Syndrome series. Thank you so much for listening to Delirium with Dementia. We hope that this information was helpful. Thank you.